In today to our fourth session of the Healthcare Insider series. The Healthcare Insider series is an IHH activity where we invite investors, analysts, the capital market, and of course friends from the media as well. This is the fourth session. Quite a lot of change since the last one. Markets have opened up, countries have opened up. We can all travel again. We are starting to see a post-COVID normal, if there's anything like that, a post-COVID normal. At least it's a new normal we all have to adapt ourselves to. First session, we've talked about COVID-19, vaccinations, implications. Second, we talked about digital health. As you're aware, IHH has earmarked $100 million in driving our digital transformation journey over the next couple of years. The third session, we talked about our diagnostics business, the laboratories, how we want to focus that and develop more dedicated strategies around the laboratories. And we just came off earlier this week a fantastic workshop, strategy workshop with all our lab staff and key experts to really focus on a growth plan over the next many years for our labs business. And today we want to talk about megatrends, and we have a great panel here for you today. And I want to introduce my panel colleagues. We have digitally, virtually with us, Dr. Ashutosh Raghuvanshi, the CEO of Fortis Healthcare. And I think, Ashutosh, you've been a medical practitioner yourself. You've been a heart surgeon, I think, before.
That's right. Yeah.
So welcome with us today.
Thank you for having me.
We have an echo, I think, somewhere. Okay, the echo's gone. We then have Dr. Clive Tan. And Clive, you are a professor at Duke NUS Medical School. You're a director for integrated care at National Healthcare Group. Many other titles. Welcome today at IHH.
Yeah.
And we have Ashok Bajpai, a very good colleague here, Group Head of Operational Strategy and Integration. Welcome, Ashok, on this panel today with us. Look, let me introduce the topic a little bit. We talked about specific topics in the last three sessions, and today we wanted to spend a little bit of time to talk about underlying trends. Why is this healthcare theme an ongoing theme? Why is there ongoing growth? What are the underlying trends that drive growth? And of course, as a private healthcare providers, drive profit pools for us as a player in this field. So we want to talk about the most significant long-term mega trends, transformation. What did COVID do to this over the last couple of years, and what does technology do in this whole setting? To start with, we want to start with a little bit of a feedback session from all the audience. We have a poll up here, and the question is, how do you as a consumer play an active role in managing your own healthcare needs? Do you use wearables like fitness monitors or health trackers, glucose monitoring patches? Do you regularly visit a family physician? Do you do self-monitoring, and do you do self-medication at home? We see the results coming back in. Very interesting. We basically have nearly 40% of the people actually using wearables. I have to say, I bought this Apple Watch 2 years ago after a visit to a heart specialist who said, "Look, I think you should watch your health a bit more." So I'm one of those, certainly. Only 10% go to regular visits to family physicians, something maybe we talk about a bit later. 20% do self-monitoring, like regular blood pressure tests and so on. 30% do self-medication. I know that at my home I have a huge box with all the old medicine in, and of course I pick it sometimes. I'm not sure it's the best advice from doctors. You can help me there. So let's jump right in the first question around trends and healthcare. What is all this about? Aging certainly is a trend. Lifestyle diseases are something that affects us all. Technology, as we just mentioned. People have never been as informed about their own health situation as they are now at the time when they go to the doctor. Consumerism is something we hear very often. From illness to wellness certainly is a trend. Let me start with Clive. Clive, how does the Singapore government view healthcare trends? And we've heard a lot about a white paper. So what are the thoughts of the government here in Singapore around the development of healthcare?
Yeah, thanks, York. So I think for the healthcare sector, we know that the key foundational pieces are always there, right? People want quality healthcare, people want good value healthcare, people want accessible healthcare. But I think what has changed is that now the populace is a lot more informed. There has been so much messaging going on about aging and preventive health, and also the screening guidelines have really kicked in and helped people to get more aware of their health conditions. So I feel that aging aside, people are now more aware of their health issues. They are consuming more services. Last time you had people coming to the doctors in their 50s and 60s to see the doctor, but now people are coming earlier because you actually start the relationship with your doctor from about 40 onwards to start off with the screening, then talk about the results, then get some treatments, get some advice. And then what happens after that is that they sort of get into regular visits with doctors, even if they are not on medications, just to check in. So we see that actually the conversation on aging has a knock-on effect to actually bring people to healthcare earlier and with also more frequent visits.
And is this why the government is now moving towards pushing this concept of general practitioners, family physicians, as a much more important theme here in Singapore?
Thanks. So I think for the overseas guests, Singapore recently started this conversation called Healthier SG. And one of the key tenets of that was to sort of tie up the residents with a fixed doctor, a fixed family practitioner, and then develop that trust relationship so that they are able to see the same doctor every time. And then from there on, the doctor is able to have more preventive health conversations with that resident or patient. So I think that's important because if you don't see the same doctor every time, how is the doctor going to advise you on your exercise habits, right, your diet habits, if it's a rotating door system? So I think that that's a great direction that we're on. Hopefully there will be good developments in the next few years that we can talk more about.
Ashok, you run operational strategy here for IHH. How does IHH look at these trends? Do you have any specific examples?
Well, it's very interesting what Clive actually talked about just now, which was about trust being built between a doctor and his patient. And we also saw on the poll just a little while ago that about half of our pollers just now also are tracking their own health. So I think the first megatrend we are looking at is greater awareness and greater awareness of just general wellness rather than sickness. So I think there is a shift towards looking at wellness and preventive care rather than just thinking of a hospital when it comes to being ill or in requirement of medical attention. Clive also mentioned something about trust and developing that trust. I think the big differentiator today that has happened amongst institutions is the credibility of delivering medical care. So IHH, for example, has been running hospitals in Singapore now that are over 60 years old. So over decades of giving quality care to patients, I think IHH has been able to develop that tradition of trust and credibility that our patients now have learned to rely upon.
So that theme around from illness to wellness and coming earlier to a family physician, getting advice on a healthier lifestyle, how does that change the access to profit pools for IHH? Ultimately, we're a for-profit business. So how does that change? Is that expanding our profit pools? Is that driving further growth, or is this a risk?
I think we have to now define ourselves as a healthcare provider rather than just a group of hospitals. And I think that expands the field of services that we can provide. But it's a long journey. I think the journey to wellness from one of caring for patients who are already exhibiting symptoms is a long one. And the minute you step into wellness and preventive care, I think there are a lot of other companies that are doing fragmented parts. I think the idea is for a powerhouse like IHH to be able to integrate a lot of those into a holistic program that covers the life cycle of the patient. So when you're a young person and you're a young father, you can take care of your child because you're the provider of care for that child. And then eventually it's going to be your child that is going to care for you. So I think we do have a journey of the life cycle of the patient that we need to now become relevant to as a person is brought into this world and then moves on.
But it all sounds like an expanding market horizon, an expanding view on a patient well beyond his specific acute illness that he has, and taking a much broader view how we can serve and put that patient at the center of what we do. Now, if we look at India, Ashutosh, do you see similar trends there? What are the key trends for growth or for the change in your environment in India?
India has its own complexities and diversities, geographical situation in many parts of the country today. We have very meager facilities available. So there is accessibility has always been a great challenge in India. And that's why here the opportunities are immense. But at the same time, the overall global trends do impact the thinking of people in India as well. As you know that there are a lot of people here who have smartphones and access to internet today. So the attitude towards accessing care is very different, and the awareness of wellness is becoming very much part of daily life. But here, what I see is that there are opportunities both in the traditional setup of hospital as well, which is just kind of an acute care. At the same time, there is also a lot of potential to create systems which are going to be more of preventive and wellness focused. And that is even more important in a resource constrained environment in which this country works. So, as Fortis, as part of the IHH broader policy, we also want to be present in various areas of touch points to the patient in their life cycle. And that is what we are focusing on with the use of technology and other means.
Life cycle view that resonates really well with what we've heard here. On a different aspect, medical tourism, is this something that for you in Fortis plays a major role as a growing trend? Is that a growing opportunity to be an international provider for certain treatments, and does medical tourism affect your business?
Certainly, international patients form a major part of our business currently. There were certain dips in that business because of the travel related restrictions, but it is back to normal. Now, in India specifically, when we talk of the medical tourism bit, we like to call it medical value travel. And the reason for that is that India provides an economic advantage, and there are many parts of the world where people are very conscious of what it costs. So they have option to go abroad because they don't have the infrastructure in their countries, and they need to travel because of the need. So it's not necessarily in the elective kind of procedures or cosmetic areas, etc., where some of the medical tourism markets, like in Central Americas, in many other parts of the world, you see. But it is a little more for the curative kind of procedures, and it is lot of it is driven value which the patients get out of this. So this is always going to be a very significant part. And as a matter of fact, the national government in India has also recognized this as a major area of growth. And what they are doing is that they have coming up with two programs of Heal in India and Heal by India. Heal in India essentially focuses on people coming to India and accessing the healthcare services and even wellness services, which are like the traditional medicine, etc. And at the same time, they are also promoting for Indian healthcare professionals to be able to run institutions abroad. So these two programs are the focus programs which the government is focusing on. Medical value travel is going to be always a very important part, especially in the South Asian context. We get patients from Africa and the neighboring countries.
Okay, that's super interesting. Let me just move back to Clive. I mean, you as a representative here of the academia and the government. I'm sure you look at healthcare cost by age bracket, and we do this as well, right? And then you say, okay, well, when someone moves towards 55 or 60, suddenly healthcare costs suddenly starts to grow. Now, Singapore is an aging population. Is this an issue for you here in Singapore?
Yeah, thanks, York. I think consumers are more and more concerned about cost, right? And they are more savvy also about comparing. I think what really we need to go beyond the cost conversation is to talk about value, right? And I think that, if surgeon A is able to do this for X dollars and surgeon Y does this for Y dollar, what's the differentiator, right? It's really the outcomes, right, of the treatment. So how do we show that it's better? I think this is something that's not so well done in healthcare, is that we don't really collect data and tell people that, okay, this is my, no, I'm surgeon A and this is the outcomes that I get consistently on a quarterly to quarterly basis, and then use that as a way to communicate with the patients that, look, I am very open with sharing my outcomes data. This is my track record, and I think the patients would feel that, okay, I know I'm getting myself into. Vis-a-vis somebody who actually doesn't show you any data and just tells you, okay, I'm the best surgeon here. How does one compare and make a choice, right?
I mean, assessing the value or the outcome is absolutely an interesting topic, and we'll come to that, Ashok, in a moment, because I think IHH has a couple of thoughts around this that are quite unique and changing the notion here. I mean, today, healthcare is time and material, right? You go to the doctor, you pay for his hours and whatever medication he gives you or whatever treatment he gives you. You're not paying for a result per se, at least not in most situations. So let's look at that question on rising healthcare cost and the transparency around bills, bill estimates, and the transparency that healthcare providers give us in terms of how much people are charged. And here we already see the question, do you think healthcare providers are doing enough to be transparent about the bills? Satisfactory? Well, okay, but could do better. And unsatisfactory, should do a lot more. And not surprisingly, people here in the audience do not feel that healthcare providers do enough in terms of their bill estimates or bill transparency. Only 5% of the audience here says there is a satisfactory way how healthcare providers are well treating their customers in terms of transparency on how much we charge or how much healthcare providers charge. 50%, 51% believe it's okay but could do better. And look, 43% basically say, hey, we're not happy. A lot more needs to be done to make bills transparent. Give me an upfront information on how much the charges are. So maybe I go back to Ashutosh and say, that looks like pretty educated customers, pretty educated consumers who say, hey, I want to know what you're charging me. I want to know what you put into me. And I want to know what the outcome is. Is this something you experience in India, that you have a consumer who really wants to make a choice? And how do you respond to that in Fortis?
Absolutely. I think in India there has been a very different situation because majority of patients are paying out of pocket, and that makes them more aware of what value they're getting out of their money. And that is why in India it has been always the case where people have been very demanding about knowing about the details of the billing process and how exactly we are charging. So, but as the trend is changing and gradually the intermediary is coming into play, where the insurance companies are coming in, are covering more and more of our population, we are seeing that the trend is changing. But as far as the cash patients are concerned, they are very aware and they demand greater transparency. So a lot of these efforts we have done in giving fixed price packages, irrespective of what the stay or the complications may be during the procedure. Those are very popular in Indian context in the entire industry, not only with us. And that is a trend which going forward I think will become even more prevalent. And I believe that this is a precursor of value driven thing, because that means that if there are complications, then the cost goes on to the institution. So it is imperative for the doctors and the institution to ensure that there are minimum complications and the outcome is good, in order to have a kind of a viable model. So pricing here in India has been very much the focus. Unfortunately, there are also certain government schemes, etc., which have very unrealistic pricing system, which is sort of barely covers the cost. So that is also becoming a large segment of patients as well. But now what that is doing in effect is that it is forcing the hospitals and the doctors to become more conscious of the outcome and how the care is being delivered, so that becoming efficient is becoming more and more important.
Before we move to Ashok to respond to that a little bit, because what you're basically saying is people do want to move to an outcome-driven expectation rather than a pay-per-use model. The team here reminds me to say we have, of course, questions that you can ask on the chat group. You can bring in questions. We want to have this a little bit lively so we can address the topics you have. So please use the chat box for asking questions that we can then bring here to the panelists. So let's take that theme of outcome-driven work. And Clive, you had mentioned it as well. So we basically triangulate, Ashok, to you. Malaysia, our Malaysian team has started with value-driven outcomes. What is value-driven outcomes?
I'm glad this has this conversation has gone in that direction, because I think it's central now. We see that costs are rising, and we also see that patient expectations for outcomes are also increasing over time. So value-driven outcomes actually talks about health outcomes that matter to the patient as a factor of the cost of providing that service to the patient. So when you see a situation where you can improve outcomes at the same cost, you are creating value for the patient. Or if you're able to maintain the same amount of medical quality at a reduced cost, that is also creating value. Now, this is a very data-driven exercise, and it doesn't happen very easily. As Clive was mentioning earlier in this conversation, that how do you know if a doctor is good? It's just his word against what he feels. But what value-driven outcomes tends to do is now pool that data of actual outcomes by various doctors for the same surgery, for the same procedure, see what the costs are for that, see what the outcomes are for that, and then make evaluation on saying how can we deliver greater value and better outcomes.
Sorry, how does that work? So you're going through. Give me an example. What kind
Sure.
of procedure would you be looking at?
Sure. In 2017, for example, the Singapore Ministry of Health started a program called the National Value-Driven Care Initiative, where it is tracking 17 specific procedures. So for total knee transplants, it actually went through all of the knee transplants that were done in the hospitals and saw that by just tracking data, the best practice was that, well, earlier, before they started tracking, 26% of the patients were getting blood transfusions. After they started tracking the data, only 5% got blood transfusions. So there was an improvement of care, and there was a reduction in the bill of $970 per patient. So immediately there was improved outcomes for the patient and a reduced cost for the patient. And that was tremendous because...
How do doctors respond to that? I'm sure it's hard to be exposed to data where then someone comes and says, hey, hold on a second, how are you doing this and how others are doing this? How does this work?
I think there has to be maturity and the correct attitude on both sides. There has to be a desire to deliver value to the patient. And I think whenever such a conversation happens, we should think of having a patient in the room listening into that conversation. And that makes the perspective correct for the provider of the data and, say, the doctor who is learning that perhaps he could be a little better or a little quicker in the OT or could use a few less consumables, because in the end, it is that patient who is going to benefit.
But the doctors still need to see this as a benefit for them as well, to
Yes.
learn something. It can't be like punitive, or you did this badly and then you get a minus point. It needs to be still something that's a positive, self-reinforcing
Correct.
mechanism. I don't know, Clive, maybe you have...
Thanks. I think this is such an important topic. I think that the first thing we need to do to convince the doctor that this is good for him and the patients is that, no, we're on the same team. We're on the same team, right? The doctor doesn't have time to collect data. He doesn't have time to look at over 12 months, how have I been doing and all that. So really the back-end data team is doing this for him and presenting it in a safe manner so that we can discuss the results in a safe space. And then I think the doctor would appreciate that, look, if I'm not doing so well, what is the issue? How come the rest are maybe doing better? What can I improve in? I think that is the important conversation, because our doctors are with us for a long time, right? And we want to make sure that they stay up to date, and that trust relationship where you can come to them with the data and have an honest conversation to say, okay, over the last 6 months, I see some dips, what could be some of the issues and how do we get better from here?
Absolutely.
We have one question here from Daniel Koo from the Star Media Group. And I'm just reading out the question. If it's value-driven outcome pricing, then how to ensure doctors pick only those patient cases that is likely to have better outcomes? Very good question, because it says, well, if you measure it by your results, well, then I just ignore those patients that are complicated and I only look at those that are working well. How do you deal with that?
It kind of comes back to what you were mentioning, York, about age segmentation. So if we take that a little bit further, it's about risk segmentation, right? And actually with good data and a good EMR system that's able to pick up some risk factors, the doctors should be able to understand that my results may have gone down a little bit because there was a group of patients that were a bit more risky that I was managing. So it's kind of, you need that richness of data to have that conversation also.
I would concur with what Clive is saying. You cannot actually go away from difficult cases because that is actually benchmarked by the risk of that patient. So if you're doing, say, any transplant procedure, you can have a relatively straightforward one or an extremely complicated one. And that actually gets built into the data as you go forward. So a knee transplant could be simple or difficult depending on age as well as the complication, and the data would actually account for that, and it would then benchmark accordingly. So it's all right for a physician to actually take on a difficult case because he knows he's not going to be penalized for it.
So data availability, collecting data, sharing data from patients with a healthcare provider, and then using that plays an important role in that discussion. I guess we talk about digital transformation a little bit later, but I wanna still probe on that topic, cost versus value. And Ashutosh, you also had mentioned value, medical value travelers, and you focus a lot on value and address this topic of outcomes. Is this a theme for you in Fortis, how you're transforming the company to really be perceived as a best practice outcome provider?
Absolutely. I think Fortis was one of the first companies in India which started publishing some of the outcomes. So 11 procedures we track, and we publish the outcome information on these 11 procedures. But I think, as earlier Clive and Ashok were saying, it is very important that the data is very sort of robust, and there is enough risk stratification so that there is no positive or negative bias in what is being reported. And that is very important. The doctors are essentially data driven, and that makes a lot of difference. So as an organization at Fortis, we have been focusing on the main driver of our reputation is based on trust and the outcomes. So that is a area where we are completely focused on, and we want to have about 28 procedures which we want to report the data over the next 1 year or so. And that would make the things very transparent, both on the cost side as well as on the outcome side.
We have another very interesting question here from Billy Chu, and I'm trying to rephrase what I've understood the question to be. It's basically the question about the trade-off between preventive health screening that ultimately reduces the bill size a patient will leave with IHH or any other healthcare provider, and acute health screening or testing, a snapshot testing. Say, well, okay, you're sick now, and then now I put all these costs in. It's of course much more costly, and it raises this question around quality of healthcare, business focus of healthcare, and the ethics and the choices you make between both. How, as IHH, how do you address this question to say, hey, hold on a second, the best patient is actually the one that never comes to me?
Mm-hmm. And I'm really grateful to Billy for bringing up this question. I think it's a very important one right now. We did start this conversation by talking about preventive healthcare and then the move onwards to wellness. Now, with innovation in AI and machine learning, we have the opportunity to actually catch a lot of these things before people even realize that there are going to be issues in the future. Now, I think we've heard of just amazing technological marvels that are happening with AI and machine learning as a base, but they're still quite fragmented. So what IHH is doing is actually talking to a large number of these companies and finding out what makes sense for the type of customer that we are dealing with. So we are having patients who are coming in earlier and earlier. We are able to actually predict and perhaps even treat before it becomes acute for a lot of these patients. And I think what essentially is that IHH is a healthcare provider that is looking to expand into being a provider for the entire life cycle of the patient. And if we are able to do a preventative journey through technology, I think we've added a lot more value to the customer and the quality of life that they will have.
Very interesting thought, and it basically focuses again on this life cycle view and how can we give quality healthcare to people, how can actually keep people healthy and prevent illnesses. But let's move to the back end of the life cycle. And Clive, before we started this panel, you talked a little bit about your early days as a family practitioner, and you went out in the communities and looked at the issues they have there. And it's a bit of a similar topic, right? But maybe you want to share what we talked before.
Yeah, thanks, York. So in my early days when I was still seeing patients, one of the most memorable experience that I had was about home visits where we visited the patient's home. And it comes back to the idea of trust, right? I mean, for the patient to let you into his home, you must have a very strong trust relationship. And then from there, you are able to see that there are some issues around the home environment that could be causing the patient to be in ill health, right? And then from there on, you advise the patient. So it comes back to this issue of a relationship between the provider and the patient and also the family, right? So coming back to Billy's point, I think that that screening episode where you come to the clinic and you speak to a doctor is actually a start of a relationship between you and the doctor. And once you see the doctor several times, you actually have this relationship and trust with him. So when you have an issue subsequently, 5 years down the road, 10 years down the road, you actually think of coming to this doctor first. And whichever network that the doctor is in, you trust his opinion and you trust his network. And I think that's how we build this longer term end-to-end relationship with the patients.
And it's interesting also for us as a healthcare provider in IHH, if you look at this life cycle view, it again not only expands the attention to a patient or customer in his earlier days, in the preventive periods, but it also looks then at new market opportunities post a certain illness or when people are aging with remote monitoring and other services. Ashutosh, are you looking at solutions like this, where you look at the remote monitoring of people who are then going home and try to recover at home and other services?
Yes, York. One thing is very clear that for a country that has consistently faced barriers of access to quality care, technology has the power to bring in the much needed solutions, and remote monitoring is certainly one of those. So we work with certain home healthcare providers, though we are not in that space ourselves at the moment, and we do monitor patients remotely. But at the same time, we have also seen that the virtual consults have also become a reality. Though we are seeing that most of these consultations are happening in the lifestyle kind of segment rather than the acute illnesses. So, for example, the mental health consults, sexual health consults, etc., are happening practically almost 90% of them are happening online. Virtual consults is one area which we are very much developing, and we have our own application which we use to for patients to access our doctors. But I think technology in Indian context is going to play a very, very important role. Remote monitoring, remote consultations, and other areas such as telepathology, teleradiology, etc. For example, in our network, we do have some smaller hospitals where we can't have the kind of expertise required to report specialized CT scans, etc. So we are able to do that remotely with the help of technology. So we are building that capability a lot, and both on the radiology as well as pathology side.
Really, really interesting how you take advantage of these various opportunities to expand. And I still remember I sit on the board of Fortis. In one of your presentations around your strategy, you talked about setting up this mental health business unit. Are you working on that? So you are setting up a mental health business that basically expands the whole clinical service and healthcare service you're providing to patients. Does that gain traction? Do you have that business already established?
Absolutely. Mental health has been one area which typically in India has been ignored, and we have dearth of professionals in that field. But the requirement has become very, very acute and large. And that is where one area where you require physical facilities as well as virtual consults, etc. So we are building a kind of a composite service for mental health, which is going to have all the areas, which includes the physical infrastructure as well. So we have already created one center for acute illnesses and people who require assistance for getting out of some substance abuse problems, etc. But other than that, we are also doing a lot of mental wellness programs, which are quite technologically enabled. So we have helplines, we have regular sessions with several corporates, which are comprehensive mental health programs. So our focus is to develop this as a large kind of business across our centers. We already have a very active mental health program, but we want to take it to the next level now.
Fantastic. And look, I'm also the CFO of IHH, so I always like growth opportunities that are very low capital, that have a low capital intensity, and that's certainly one of those. But I think it's good for the patient, because you are looking at a patient in a much more comprehensive manner, and maybe even families. I would assume you are also supporting families or spouses of acute illness patients, to help them during this crisis. So again, it's a real expansion of services. Let's, by the way, please be reminded, questions in the chat box. Very happy to respond and bring to our panelists. Let's pivot a little bit to data. We talked about data before. You said value-driven outcomes is very focused on collecting data. Clive, you mentioned providing data and insights to doctors helps them a lot more in understanding best practices and maybe striving and working together to develop better best practices. We've put $100 million at play to put a patient-centric ecosystem out there. We are just launching new app services and new opportunities for patients to log in to our network. I know that Fortis is working a lot on the digital transformation. We had our laboratories head in India, Anand, talk about artificial intelligence supported analytics around lab data to give better insights to patients or customers in terms of their blood tests and their wellness. Now, when it comes to digital investments, you suddenly talk about very large numbers, and then you come to barriers. Data protection rules, private data protection laws, compatibility issues between different providers. What is the government doing to help healthcare providers cut through this and maybe work together better in data sharing and getting more information out of data?
Yeah, thanks, York. So indeed, the data sharing topic is very hot right now, partly driven by the whole conversation on healthcare SG and population health. I think for us to be able to want to do population health well, we need the data to be shared, right? Because the patient's not just going to be coming to one site or two sites, they're going to be moving around. And not just with the healthcare providers, but also with the social care providers, and in the future, maybe the fitness providers, right? Because we are talking about preventive health. So I think currently a few things happening is that we are trying to move towards a common NG-EMR record, right? EMR record that's a bit more, one system at the national level. But I think that we are also talking about bringing in the non-government healthcare providers, right, to see how we can share data better at the ecosystem level. A lot to unpack, definitely, but I think that what it means is that when this data is shared across a range of providers better, we're definitely going to have more patient-centered care. But I think that you're right, there's a lot of trust issues. We need a safe framework, we need a safe ecosystem, and we need to move towards a model where it's away from data ownership to data stewardship. The difference is that when you are data owner, it belongs to one person. But when you are talking about data stewards, actually a lot of people have access to the data. But because they are stewards, they know how to treat the data responsibly and manage it safely. So that's the system that we need to move towards. It's going to take a while, though, I warn you.
I'm sure that's a long journey. Ashok, what are we doing on? Are people giving us their data, or do we use their data? What are we doing?
Well, we work in multiple countries. And while I think we have established very clearly during this conversation that digitalization and data is really the backbone for better patient outcomes and for growth. So it's imperative that we are able to solve this. Now, in a relatively homogeneous country like Singapore, we are hearing Clive saying that it's going to be a long journey. Now, when we look at the other countries that we are working on, there are different data protection laws, privacy laws. There are a lot of laws about migrating data outside of a country's borders. So for us to be able to steward data as a multinational corporation at one place is virtually impossible at this point. And I think we must respect the laws of each and every country and make sure that we abide by them within those geographies. So what possibly could happen for us, as I see, while we operate in about 10 countries, is that we have microcosms of data stewardship within those countries. And we are able to create those islands of best practices within those borders so that the patients that come to us actually get better value-driven care. So it's one of those things that one wishes that there could be, international portability of numbers, of data. It would help the patient. But given where we are in our journey, where data is still relatively new, I think we will continue to evolve as the laws evolve around the world.
But we are making progress.
Oh, absolutely. And I think the investments we are doing around the world to centralize our data and to create systems for us to provide that data to our doctors and to our patients is really now beginning to bear fruit.
Ashutosh, India is like the IT powerhouse of the world, right? I mean, we have so many amazing Indian IT capabilities, a lot of IT talent. But how can you, in Fortis, capture the required talent to develop such data-focused solutions, IT solutions? Can you hire these people? Are you hiring enough talent to manage this? And how is India playing in that whole data transformation? What role is India playing there?
Yes, sure. Yog, I would say that hiring the best talent for a healthcare company for technology is a challenge. Though in Indian market, as you said correctly, there is a lot of talent available, but hiring that talent as a healthcare company is a challenge which we have been facing. Having said that, in India, there is a program which is going on from the government. It's a public initiative from the government, where a unique health ID is being created for every individual in the country. Of course, it is something akin to our national identity program, which is called Aadhaar, which means the base. So it's going to be a similar program of size and scale. Our population is huge, so it's going to be a very large exercise, which is going to certainly take a lot of time. But the idea is that the data should be universally portable. All the concerns related to privacy, etc., which Ashok mentioned, are taken care of, and then this becomes a kind of a interchangeable data which is available to the entire ecosystem of healthcare at whatever access point it is required. If it is required for the patient's individual's care, or it is for the population health purposes. So that program has started working, and we, as a healthcare provider, they have created a sandbox in which we have started creating certain other products also, which are on top of the platform which is being built. This is a long-term program, but definitely it's a very good start. So as a company, we are focused on being an integral part of that, uh, the, doing the right kind of data stewardship. And we are one of the first companies, you will be happy to know, in India, which has appointed a data privacy officer, even before the data privacy law has not yet been formalized, but we have already appointed a data privacy officer as well. And we follow very high norms of the data integrity and data protection. So I think we will be taking it forward and getting into it as we go forward. But the technical challenge, talent is a challenge.
I think we hear this everywhere in all our operations to get the right talent. So probably a lot will also go through partnerships, partnering with other companies, maybe with larger IT players. I think partnerships is the way to go. Agility is the way to go, and it's kind of an interesting one. On the one hand, we talk about data stewardship, data privacy, and yet, Clive, you said your first comment was it's all about sharing of the data. So in order to get value out of it, it's not enough to keep it for yourself. You need to be part of a larger pool of sharing it. Ashutosh, that's what you said, the government is driving towards. And we see this, I guess, in many of the use cases that we have, that once you start opening up, inviting others, bringing analytics in, that's when you then see the real value coming. So on the one hand, data stewardship and data privacy, on the other hand, facilitate sharing, responsible sharing, to create the added value for doctors and for patients. It's something that we have to solve for, and I guess everyone's working on that. We have a question from Mark Matthew. We hear a lot about telemedicine, virtual consultations, testing these days. Does IHH see any opportunities to provide more care at home for acute type of illnesses, given the increasing demands of consumers? Ashok?
I think if you look at the time of COVID, when telemedicine began to take off, there were various experiments that took place in telemedicine. And we saw that first consultations were generally fairly successful. But when it comes to a few acute illnesses, then you do require testing, lab testing, you require specialized equipment. Now, some countries that we work in actually do have even portable X-ray machines that will take an X-ray for the patient at home. Of course, lab tests are now ubiquitous. You can have your labs come to your home fairly easily, and I think IHH is investing a lot in developing that around the world. But when it comes to regular treatment, I think eventually one will have to go to a hospital. And I think if it comes to a place where surgery is required or if there's any other intervention required, then the patient will have to come. So I think there are limits to telemedicine, but I think it's an early indicator and it's an early way of catching something before it becomes too bad.
And it's probably a question of reach out to say, I make my service available where the patient wants it, rather than saying, well, you have to come to my place of business, otherwise I'm not looking at you as a customer. So I think it is, again, the similar theme across the life cycle, expanding treatment and wellness and healthcare opportunities beyond the few limited times or days he is in a hospital.
I think the key word here is convenience. And if we are able to provide healthcare to a certain degree through telemedicine, it adds value to our customer. It provides convenience for people who are obviously not feeling well already. But then the next step sometimes is to go down to a clinic or a hospital for further treatment.
So convenience, Ashutosh, comes back to the question of consumerism. You talked about it before. Is it a threat for you? Is it an opportunity for you?
I think that's always an opportunity. We need to respond to it in a positive manner. I think that is always an opportunity. In many ways, you can sort of attract the behavior of the consumer to be positively disposed towards an organization by simply being an organization which provides trust and care. So I think our focus is in that direction, and I strongly believe that's an opportunity.
Okay, that's great. That I think resonates a lot with what consumers, probably also a lot younger people, would like to see, to have their healthcare practitioner to be approachable and to really look at their needs and look at the. So what we have learned during this session, if I just take a couple of key points in terms of underlying trends in the healthcare industry, there is an amazing growth opportunity from an aging population. It is real. Population does get older, and once you get older, your healthcare spend increases. Secondly, there is an increasing view towards a life cycle view of a patient, of an individual in early stages, when he grows up until to a senior age, well beyond the 1.5, 2 or 3 days he spends in a hospital, but really looking at services beyond that. And we see that data provides transformation to the industry by offering value-driven outcomes, moving from a time and material-based charging to an outcome-driven charging model, up to analytics, helping giving better insights to doctors, but also to patients and to people to manage their health and their wellness. I'm asking one last question around, are there any more questions from the audience that you'd like to look at? And if not, then I would still ask everyone to look at our QR code to give us feedback on the session. I want to thank the audience a lot. Clive, thanks for coming. I just saw you met Linus, who's an old friend, I believe, so
Yeah.
hopefully we can reconnect. Ashok, thanks for joining me, and Ashutosh, we'll see each other at the board meeting early August in Bangalore. Thanks for dialing in, Ashutosh, and joining us today. Thanks everyone for coming. I hope this was an informative session for you. Please do give us your feedback, maybe ideas on what would be themes for the next Healthcare Insider series, and other suggestions on how we can make this forum here attractive and informative for you as audience, from the capital markets, from the media, from the general public, to bring IHH closer to you. And with this, I'd like to close the session. Thank you very much for dialing in, and thanks for joining me here on the panel.
Thank you.
Thank you.